What is the current landscape of implementation research?
But then it takes my mind back many years ago, maybe as far back as 2007, when I started engaging with WHO TDR on issues to do with implementation research. So, I mean, from 2007 up to date, there have been monographs. The toolkit, as we see it now, started as a curricula, and we changed over to a toolkit, and it has stayed on this course. We've had courses run in applied health social science. Actually, we started the first one at the University of Ghana, running the IR module. Then we've had different capacity building efforts. Now we have the MOOC, we have the MScs and PhDs in implementation research. So you can see that it has been quite a long journey, and things have developed along the way. I will say that as a result, the number of donors and scientists and publications in the space, I would say, have increased. If you take funders like EDCTP, who mainly focused on clinical trials, they shifted direction. So for their second program of work, they included implementation research as an area of interest and started funding projects in implementation research, and had a whole scientific review committee on implementation research. The UNDP, particularly the Access and Delivery Partnership, now has a huge focus on implementation research, and so does UNICEF, USAID, the World Bank. So over the years, things have changed. In the beginning, you didn't find too many people in that space. Even when it comes to publications, you have journals that are dedicated to publishing work on implementation research. And a couple of years ago, some of my colleagues and I even got a publication on implementation research in the Lancet, trying to define it and explain what it means. So I think things have changed a lot, and increasingly, many more people are beginning to understand, and many more people are beginning to support work on implementation research. Now, to your question on why this is happening, I think the world is kind of coming to the realization that research should not be conducted just as an academic exercise, but really to meet the needs of those who we claim have the problems that we want to address. So if we have a problem on malaria, why do we sit in our office and coin what the problem is and try to answer the question? The people who deal with malaria on a daily basis are in the communities, are in the countries, and we need to engage them to understand what their challenges are. We need to understand the problem from their perspective rather than our perspective. And I think funders realize that they gain a lot more when they see good results coming out from partnerships between academia, researchers, and the program implementers at country level.
What are the reasons implementation research is important for health systems in low and middle income countries?
Let me say that implementation research is not particularly important only in health systems in low and middle income countries, but it's important for health systems everywhere, because as you know, implementation challenges happen everywhere and in any health system. So the concept can be applied everywhere, education, health, wherever. But I guess particularly in low and middle income countries, because of the conditions that we face and the diseases that we encounter. So why is it important? I mean, you realize that health systems implement in real life, they operate in real life. Real life is complex. People change, governments change, systems change, policies change. And you know, one of the big characteristics of IR is that it is conducted in real life. And so to be able to address some of these things, IR really stands a good place to be able to deal with some of these complex issues at the country level. And then the greatest thing is that health systems are characterized by teamwork. You have public health, clinical care, lab work, And all these need to work together to see that the health needs of people who use the health system are met. IR is teamwork. It requires people with different competencies, different backgrounds, different skills to come together to address specific implementation bottlenecks. So I think IR really is important for our health systems in which we work, and it will help us also engage with the relevant stakeholders. And that is one of the key characteristics of IR, stakeholder engagement throughout the entire process. And I think that's why it's relevant for work in our health systems as a whole.
What type of skills and competences needed to achieve favorable IR outcomes?
You need multiple skills to be able to conduct IR effectively. I think we all know that IR is conducted in phases. Once you have identified a problem, you need to be able to really define what the problem is, really work with various stakeholders to be able to solve whatever problem you have identified. And I guess each phase really has the specific skills and range of competencies that are needed to be able to address the issues in each phase. So for instance, let's say you are looking at issues to do with introduction of new health technologies into the country, into any country. Take the new malaria vaccine, for instance. It was introduced through our health system through the expanded program on immunization. And then there were evaluations, qualitative and quantitative evaluations. Now, I was part of the team that did the qualitative evaluation. And to be able to understand what the issues are within the health system, we needed to spend time in the districts and the communities where these vaccines were being rolled out. So in the initial stages, we spent close to 8 weeks trying to understand the context within which these new vaccines were being introduced. So if you ask me, in the initial phases, I'll think that social science skills are critical, because we're able to understand the community, we're able to understand issues like why a community which is not close to a health system or a health facility is able to get very, very high immunization coverages, whereas a community that is close to a health system had low immunization coverages. And a lot of this information impacted on the reason why we had some of the results we had in the deployment of the new malaria vaccines. But not to belabor the point, yes, social science skills are important right at the beginning to understand the context. But when it comes to the various interventions that are needed to address the problem, you need other skills. So when we identified some of the challenges regarding to the skills of the health workers to identify the eligibility criteria for children to receive the vaccination, and issues around health education and training and storage of the vaccines, we needed to bring other people who had those skills. So the epidemiologists, the health communication experts, and all those had to come to bear to be able to put together different interventions that would improve the challenges that we were facing. So I would not stick my neck in and say one particular skill is critical. It depends on the problem that has been identified. It depends on the stage of the implementation research that you are at to decide which skill is relevant.
Why should the IR self-assessment framework and its new online tool be suggested to IR project developers?
So I've been doing these IR training workshops for quite some time now. And I guess over the years, we've learned that when we invite people to come to these workshops, they need to really look at the problem that they have identified to work on, and look at who has the capacity to be able to work to address the problem. So we really don't predefine who should come. We tell them, based on the problem you have identified, who do you think are the best to help address the problem? Of course, you need the program manager, because they are the ones on the ground who understand what the problem is, or the policy maker, or whoever it is. And then when it comes to the research design of the implementation research, of course, we use pragmatic approaches, but then there are specific skills that people may want to bring to bear. It could be in health economics, it could be in evaluations, it could be anything. So we leave the team themselves to decide. Of course, then it gives them an opportunity to self-reflect and ask themselves, what skills do we have that will help us address the problem? The other thing that we have done is to use the self-assessment framework. I guess a lot of it built onto the new self-assessment tool that is currently being promoted on the website currently as part of the online tool. So people ask, we ask if they have some awareness, understanding, knowledge, or skills or competencies in IR, writing proposals, etc. And so, like I said, people just prepare themselves, come to the workshop knowing that they are bringing people who could contribute a lot towards the proposal development. Then you find out that when we realize people have said they are interested, but they have certain deficiencies in certain places, when we are teaching the course or going through the workshops, we emphasize quite a bit on areas where people have expressed a kind of weakness in that area. So that is the advantage of the face-to-face. But currently, the tool is online. So when you assess yourself and you realize that you have a deficiency in a particular area of IR, I guess it pushes you to be able to go first to that area where you have a limitation and begin to read more and understand that, and it helps you strengthen your skills and competencies in those ways.
Who should conduct IR self-assessment framework?
I mean, even myself, I mean, when the tool came online, I went through it, and as I looked at the way the grade was, I was asking myself, have I improved my skills, or have I try to further other skills to the detriment of other skills? So I think anybody who is embarking on an IR project, I would say whether you are a veteran in it or you are new, just go through the self-assessment and ask yourself a lot of questions, because as you are aware, new models are being added to the toolkit, the online toolkit, every time. There's the gender, there's the ethics, and so many things. So if all these things are put within the self-assessment framework, then before you embark on the toolkit and decide which area you want to go to, you would have assessed yourself and decided where you need your skills to be strengthened a bit more.